Welcome, Lowell Public Schools families. We're here with another back to school update. Today, I'm joined by Marianne Bastide, who is the safety coordinator for the district. And we're going to be talking about a really important topic, COVID safety and procedures, as we're at the start of the school year. And of course, on Monday, September 28th, we welcomed back the students in grades 1 to 12 who received an in-person seat in the lottery process, joining their classmates who received an in-person seat who were in kindergarten and preschool, who had already previously started going in person. So now we have a good number of students in person. So we think it's really important to be able to share with you how we're going to be addressing COVID safety now that we have students back in our school buildings. So we have a nice presentation for you on this video, and I'm going to turn things over to Marianne Bastide. So Marianne, thanks for joining us.
Thank you. Thank you, everyone. Thank you for being here and listening to this very important information regarding how we're going to be handling COVID in our schools. We're going to be talking about several items. One will be around COVID protocols. It will also be talking about the mask policy and also how we're going to be communicating with you should students test positive in your school. So those are the three topic areas that we're going to be covering today. So the first question, one of the biggest questions that we get asked a lot is, can your student go to school? If they feel sick or have COVID symptoms, and some of the symptoms that the CDC has deemed COVID symptoms are a fever of 100.0 or more, chills or shaking, cough, difficulty breathing, loss of taste or smell, sore throat, headache, aches, nausea, vomiting, diarrhea, fatigue, nasal congestion, and runny nose. Now, those are some of the symptoms, but those are also some of the symptoms of just not feeling well. They're not necessarily everything is COVID, but those are some of the questions that you want to ask about your how your child is feeling. If they don't have any of those symptoms, absolutely they can go to school. If they do have those symptoms, some of the things that they should do are, first, contact your doctor for guidance. That's always the number one thing that you should be doing. Number two, through your doctor's consult, you should consider COVID testing. Depending on whether some of those items, if you just have a headache, unless you have a couple of other symptoms, they may not suggest that you do COVID, but that's certainly something that the doctor can speak with you about. If you don't have a doctor's note or a negative test result, you cannot return to school until you have self-isolated for a full 10 days and your symptoms have improved and you've been fever-free for 24 hours with no fever-reducing medication. I would have to say that this slide is one of the most important ones, and I would definitely keep this handy as you're deciding whether or not your child can attend school.
And Marianne, I just want to jump in and let everybody know that you can go to the Lowell Public Schools website. We have a back to school information section, and this slide, along with the other slides you'll see in this presentation, are included on the website, so you'll be able to look at it even after this video is over.
Thank you, Jeffrey. And this slide presentation is also going out to all of the principals and all the schools, and everyone will have the same awareness. We've already sent the charts out to all the principals as well. Thank you. So if your child got a COVID test and the test was positive, some of the things that you need to do next are call your school nurse. You definitely need to call the Lowell Health Department. The phone number is right there. And we also suggest that you inform your close contacts. This part is important because close contacts are deemed somebody that you've been with for 15 minutes or more in less than 6 feet of distancing. Right now, it does not depend on whether you're wearing a mask or not. It really is if you've been within 6 feet of somebody and it's been for at least 15 minutes. So those are close contacts. And before you return, you need to make sure that you self-isolate for the full 10 days and be fever-free again, improvement of your symptoms, and you need to be cleared from the Lowell Health Department. So you'll have to check in with the Lowell Health Department, give them the update on your child, and then you will get cleared from them. You'll get a letter from them clearing you. If you got the COVID test and you are negative, but you're still having 6 symptoms, we do suggest that you stay home until you have no symptoms for 24 hours. And if symptoms persist, please make sure you call your doctor. If you're not having any symptoms, then you can go to school, and that's if your test is negative. So the next question is, if you've had COVID, has it been 10 days since you've had that positive test? If the answer is yes, it's been 10 days. And the next question would be, have you had 6 symptoms in the last 24 hours? If the answer is yes, you still need to make sure that you self-isolate for the full 10 days, be fever-free for 24 hours, improvement of symptoms, and get clearance from the Lowell Health Department. If no, you can return once you've been cleared by the Lowell Health Department. So the most important thing to remember here is that you have to be cleared by the health department no matter what. And then, has it been at least 10 days since a positive test? No, it hasn't been 10 days yet. So you need to make sure that you remain home and make sure that you self-isolate for the full 10 days, be fever-free for 24 hours, and make sure you have improvement of symptoms and clearance from the Lowell Health Department to return. Another important factor, and one that's come up several times, is that you have a close contact that was COVID positive. So the very first thing you should do is, if you've been called by the health department and they've said that you are considered a close contact, or someone has called you that is tested positive and you know that you've been a close contact, you should make your doctor aware. That's the first thing. Then you should get tested 4 to 5 days after your exposure, because right now the information that we have, if you're getting tested, within a day or two, it may not show up as effective. So you really need to make sure you wait the 4 to 5 days after exposure, and then you must quarantine for 14 days. So when you get tested, if your test was positive and you follow the yes, you need to make sure that you remain at home. You call the school nurse to make sure that the school is aware. You call the Lowell Health Department with the number right there. You inform your close contacts, so anybody that you've been in contact with for 15 minutes or more in less than 6 feet of distancing. And then before returning to school, again, follow all the protocols, self-isolate, make sure you're fever-free, you have improvement of symptoms, and you get clearance from the Lowell Health Department. So if you were close contact and you tested for COVID and you don't have COVID, but you're having 6 symptoms, you still must quarantine for 14 days because you've been a close contact. If symptoms persist, make sure you call your doctor, and you also need to get clearance from the Lowell Health Department. And even if you're not having symptoms, this is really important because definitely there's people that are asymptomatic, but they still need to quarantine for 14 days. Very important.
So basically, seems like the takeaway here is that if you're in close contact with somebody who was positive, whether you yourself test positive or not, you need to quarantine.
Yes, thank you.
So I'm going to skip ahead a few slides here, and we'll go to our What happens when somebody tests positive, and if you could walk through what schools will be doing?
Sure. So if your child has been to school or another child has been to school and we find out that they have tested positive since they've been to school, that school will communicate directly with all families at the school that somebody has tested positive. That letter will come from the principal of the school, and it will include the last date that student was in school. So if your child hasn't been in school um, while that child was there, then you certainly don't have anything to worry about. Parents of students who were in close contact with the community member will be notified privately from the health department. So if you don't get notified by the health department that you were close contact, you don't have anything to be concerned about as far as your child possibly getting COVID. So the first thing will be the principal will send a letter home saying that a student or a staff member in the school community has tested positive, and then the calls will go out if you are considered a close contact. We cannot provide specific information, as I'm sure that you're aware, for any individual who tests positive. So in other words, unless you are notified by the local health department, you are not considered a close contact of the affected school community member. Again, just as a reminder, and we can't say this enough, and close contact is defined as being within 6 feet of distance for at least 15 minutes. So if you pass someone in the hallway, you were close, or you practically, or your child practically bumped into them and you pass in the hallway, that is not considered a close contact because it wasn't for at least 15 minutes.
Now let's go to the face mask protocol and guidelines.
Thank you. So right now, this is the protocol and guidelines that Lowell schools have. Until further notice, all students, employees, volunteers, visitors are required to wear a face mask at all times while they're entering our buildings, on transportation school buses, and attending or participating in any Lowell Public Schools sponsored events and activities. You cannot enter or move within the building without a face mask. They may be removed, as you know, for eating or drinking in designated spaces within each building. The face mask should have 2 or more layers of washable, breathable fabric, completely cover your nose and mouth. It's very important that it covers both the nose and mouth, and it should fit snugly against the side of your face and not have any gaps. You may not use face masks that are made of fabric that makes it hard to breathe, or have the valves or vents which allow virus particles to escape, or that are intended for healthcare workers, including N95 respirators. Additionally, you may not use the following face coverings, as their effectiveness is currently being evaluated by the CDC and is unknown at this time. That would be gaiters and face shields. Some exceptions to mask requirements are anyone that has a medical condition, a disability, or other health and safety factors which impact an individual's ability to wear a mask. In these situations, we will need a doctor's note, which will be given to the school nurse. Employees working alone in a private office or workspace do not need to wear a mask, but must put one on when they're leaving their office space. So as you see, Jeffrey and I are working in our private workspace. We don't need to wear a mask, but as soon as I leave my office, I need to make sure that I have my mask on, or if someone enters my office, I need to make sure I have my mask on. At meal times and mask breaks and recess are times when masks may not be required as long as 6 feet of distancing is applied. The mask breaks will be determined and communicated at each school by the principal or designee. Please seek further guidance on these exceptions through your school nurse, principal, or designee, and also make sure you work with your doctor if you're concerned. Next, it's recommended that everyone wear a plain face mask and or a Lowell Public School or college or university logo mask. Ultimately, all masks must follow the school dress code. And just taking a quote from the school dress code: in the spirit of maintaining an orderly and safe learning environment, students are prohibited from wearing any article of clothing or carrying any backpacks or other accessories which are lewd, which promote violence or hate of any individuals or groups, or which degrade the beliefs of others. Also, any dress that distracts, disrupts, intimidates, or provokes can be deemed inappropriate by the principal or designee as well. We're just trying to keep everyone safe and want to make sure that everyone understands those guidelines.
Great. So now for more information, we have some links on our website that you can go and look for the full face mask protocols and guidelines, and also to read the full letter explaining COVID procedures and processes.
Jeffrey, I just wanted to summarize a couple of important points.
Sure.
One is that parents should always consult their doctor with any questions they have about COVID. That should be the number one phone call that you make. Also, anytime you have any updates about your child's health, you really should contact the school nurse so we can stay updated and make sure that we keep your child safe. Additionally, I would check the websites for any updates that we have. We know that we're getting updates weekly from the CDC and from the Department of Elementary and Secondary Education, and things do change, and we will make sure if there's any really important changes that you need to be aware of, we'll make sure that those messages come out from the principals. And lastly, I would say if you have any questions about this video, I would definitely check in with your principal or your school nurse or the designee at the school, and they should be able to help you. We're all in this together and we're all learning, and I think that these guidelines will definitely help you answer questions as you go along, and I hope your child stays safe. And if you have any questions, make sure to ask. Thank you.
Well, thank you so much, Mary Ann Bastide, the safety coordinator for the district. I'm Jeffrey Pickett, the community outreach strategist for the district, and we want to thank you for tuning in to another back to school update. Be safe and be well. Thank you.
Thank you.